Hello, my name is Adriana Veronica, and I will be presenting my ethical case analysis on abortion. To begin, the scenario is Bethany. She's a 17-year-old girl who is pregnant, and she comes to see you as a school counselor for advice on abortion. She also lets you know that she trusts you and sees you as an educated adult that she would want advice from. The dilemma and problem is that the student is a minor since she is 17 and has not yet disclosed her pregnancy with her parents. The student does have a right to confidentiality and privacy regardless of her age. And the school district does not have any existing policies set in place to forbid school counselors from discussing abortion with students. And Stone states that school counselors may assist students with value-laden issues such as abortion if they are competent to give such advice and if they proceed in a professional manner. There are very many moral and religious perspectives against teen pregnancy and abortion, so that is something that we will keep in mind. We will also consider the moral principles of beneficence, non-maleficence, loyalty, justice, and autonomy. So we want to make sure the student is making the decision that won't cause them any harm or damage. We have to think about their emotional and physical, mental health as well. And we want to make sure that we guide them and they can make their own informed, independent decision. So a few of the ASCA the American School Counselor Association ethical standards for school counselors that we will take into consideration are A1D, so acknowledge the vital role of parents and guardians and families. We will also look at A1F, so we will respect students and families' values, beliefs, sexual orientation, gender identification, expression, and cultural background, and exercise great care to avoid imposing personal beliefs or values rooted in one's religion, culture, or ethnicity. We will also look at A2E, so we will keep information confidential unless legal requirements demand that confidential information be revealed or a breach is required to prevent serious or foreseeable harm to student. Serious and foreseeable harm is different for each minor in schools and is determined by students' developmental and chronological age, the setting, parental rights, and the nature of the harm. School counselors consult with appropriate professionals when in doubt as to the validity of an exception. A2F, we recognize the primary ethical obligation for confidentiality is to students, but balance that obligation with an understanding of parents and guardians' legal and inherent rights to be the guiding voice in their children's lives. Also, school counselors understand the need to balance students' ethical rights to make choices, their capacity to give consent or assent, and parental or familial legal rights and responsibilities to make decisions on their child's behalf. And then the California minor consent and confidentiality laws. A minor may consent to medical care related to prevention or treatment of pregnancy, except sterilization. And also a minor may consent to an abortion without parental consent and court permission. So our own personal values, we will consider our own personal morals and religious views on abortion. Stone states a school counselor who is vehemently opposed to abortion could not work ethically with a minor in the throes of an abortion decision. So if this is the case, we would remove ourselves from the situation if that is possible and refer Bethany to another school counselor. We will consider Bethany's chronological and developmental age. So she is 17, she is mature, and she is almost an adult. And then Bethany's parents have a right to be informed due to the fact that she is a minor. Our potential courses of action include encouraging Bethany to share her situation with her parents. We can outline the potential benefits of discussing this subject with her parents and let her know that they might be understanding, supportive, and accepting. Bethany might decline sharing with her parents out of fear or shame. We can consult with other professional counselors or supervisors about this ethical dilemma. We will listen to Bethany share her thoughts and emotions while allowing her to explore further options. And we won't impose our own morals and values. It is important to control nonverbal cues such as facial expressions, body language, tone of voice. And then lastly, we can disclose Bethany is pregnant to her parents without her consent. My recommended course of action would include me attempting to make Bethany feel comfortable and safe by exhibiting unconditional positive regard, empathy, and genuineness. She will be very vulnerable and having a lot of emotions, so just having a safe place for her to express her feelings and not exhibiting any judgment or anything that will make her not feel comfortable or safe. I would also speak to other professional counselors, so if there are any available at my own school or another location, or my supervisor, principal, even school attorneys. I would encourage Bethany to open up about her pregnancy with her parents and the potential benefits, so her parents could be understanding and supportive. If she continued to refuse sharing the pregnancy with her parents, I would allow Bethany to express her emotions and concerns regarding the pregnancy. I would utilize active listening and let her explore all of her options. Stone states that generally speaking, it is best practice to let her suggest possible courses of action and good and bad consequences of each. And it is important to not provide advice or impose any of my own morals and values onto the student, Bethany. And our references, we've used the ASCA Ethical Standards for School Counselors, California Minor Consent and Confidentiality Laws, and Stone's School Counseling Principles, Ethics, and Law. Thank you.